Hello and good day everyone. Our topic for today is all about moral dilemma, for which our group will going to discuss and try to balance the situation, making it morally right and justifiable. Our group is composed of different degree programs, and we decided to relate our dilemma to one of our nursing student classmates. Our scenario explains the situation wherein you are a student nurse and there are no senior or emergency staff available, but you are strictly prohibited from treating patients because you are not yet at that level to administer treatments. The question is, would you take action or just leave the patient? Our discussion for today is composed of the following. First, we gather the facts, we identify the stakeholders, we articulate the dilemma, list the alternatives, compare alternatives with principles, weigh the consequences, and finally, we make the decisions. Sa pagsasaliksik ng aming grupo, naging maingat kami sa pagkolekta ng impormasyon at maayos na inaral ang mga sitwasyon. Inisa-isa namin ang mga posibleng mangyayari at mga bagay na maaring gawin upang masolusyonan ang dilemang ito. Ayon sa Nursing Act of 2002, Republic Act No. 9173, hindi maaaring mag-administer ng treatment ang isang student nurse sapagkat hindi pa ito kwalipikado na gawin ang pagbibigay lunas. At hindi nabanggit sa naturang batas kung ano ang maaaring gawin ng student nurse kung sakaling mayroong emergency and kailangang dagli ang lunas ng pasyente.
In identifying the stakeholders, we should identify all the individuals affected by your decision, including the patient, senior nurses, and you yourself as a nurse.
Articulate the dilemma. The dilemma here revolves around being a student nurse faced with a situation where an emergency emerges and there is no senior personnel available at that time. Yet, treating the patient without supervision by a higher senior specialist is strictly prohibited due to a lack of expertise. The dilemma highlights whether to take action, aid, or just leave the patient unattended.
In a situation where you, as a student nurse, encounter a patient with no senior staff or emergency responders available, the ethical imperative is to prioritize patient safety. While the urge to take action might be strong, directly treating the patient with no necessary expertise could cause more harm. Moreover, in ethical framework, the principle non-maleficence emphasizes avoiding harm to the patient. Since you're still under training, intervening with a complex treatment could be detrimental. By doing good or beneficence, your ethical duty lies in promoting the patient's well-being by quickly assessing the patient's vital signs and condition. Provide basic comfort for measures like positioning, maintaining warmth, and offering reassurance. And the important thing is immediately call for help using all available resources, other nurses in hospital, doctors on call, or emergency services. Clearly explain the situation and the urgency of the case. Keep a clear record of the events, including the time you noticed the situation, the patient's condition, and the steps you took to get help. Also, you need to be honest with the patient about the limitations. Explain that you're a student and cannot provide a specific treatment, but you've already called for help. After the situation is under control, discuss it with your instructor or a senior nurse. This will help you learn from the experience and prepare for the future emergencies. You can also consult your specific nursing program's code of ethics or the ethical guidelines set by your country's nursing association. Remember, your primary role as a student nurse is to learn and provide basic care while upholding patient safety. By following these steps, you can navigate this difficult situation ethically and effectively.
Compare the alternatives with principles. In the given moral dilemma, in which a student nurse must negotiate an emergency situation with no senior personnel or emergency responders, the ethical principles at play are the following. First is non-maleficence or avoidance of harm. The student nurse should avoid causing harm by refraining from performing treatments for which they are not qualified. This principle highlights the significance of understanding one's own limitations in order to avoid future harm. Based on Aristotle's virtue of ethics, The student nurse's actions should reflect virtues such as prudence or practical wisdom in assessing the situation, courage in facing an emergency, and honesty with the patient. The decision to provide basic care, avoid harm, and seek help aligns with developing a virtuous character. By acting prudently, the nurse demonstrates the virtue of good judgment, balancing action and restraint. Second is beneficence or doing good. While the student nurse cannot administer advanced treatments, they can nevertheless support the patient's well being by assessing the patient's condition, keeping them comfortable, and asking for assistance. Beneficence focuses on actions that improve the patient's well being. And according to Aristotle's explanation, virtues like compassion and practical wisdom would guide the nurse to do good. Additionally, promoting well being fulfills the natural purpose and the duty to benefit the patient aligns with moral law. Third is we have veracity or honesty and transparency. The student nurse should be open with the patient about their limits and explain that assistance has been requested. This promotes confidence and ensures ethical transparency in the nurse-patient relationship. Kant's deontological ethics reiterated the idea of duty and obligation that one should act according to his duty and responsibility. In so doing, goodwill is attained in such a way that you should act based on your duty patterned in reason. Moreover, honesty is a virtue that builds trust, and truthfulness is a natural human good. That's why being truthful is a duty and respects the moral law. Fourth is accountability, or responsibility and learning. So once the issue has been resolved, the student nurse should consult with an instructor or senior nurse to learn from the experience and improve their response to future situations. Accountability promotes continuous professional development and adherence to ethical standards for the reason that continuous learning cultivates the virtue of wisdom, which is considered as a human natural capability and could be a guide in making a decision. Seeking knowledge fulfills the natural human purpose of intellectual growth, and accountability respects the duty to improve and adhere to moral laws.
Weighing consequences of the dilemma. When a student nurse responds to an emergency without senior staff, there are a number of serious repercussions that could arise, such as threats to patient safety, professional standards being broken, inconsistent patient outcomes, missed opportunities for personal growth, and effects on team chemistry. However, the advantages of acting autonomously include the capacity to offer prompt attention, develop critical thinking abilities, show initiative, boast self-esteem, and exhibit ethical considerations. To guarantee the greatest possible outcome for the patient while maintaining ethical standards and professional integrity in healthcare practice, balancing these elements takes careful attention. Similar to the recent events in Cebu City where a 54-year-old woman who was about to pass out after being stabbed in the neck by his rumored partner while selling mangoes received first aid from a student nurse named Angel Faith Ababat, a former Wisconsin student who is currently a student at the University of Cebu, who happened to be passing by close to the scene. When she saw that no one was offering assistance, she put pressure on the wound with a discarded shirt in an attempt to stop the bleeding. A passerby noticed Angel's compassion as a nurse and complimented her boldness. In spite of the circumstances, Angel and her classmates keep an eye on the woman's health and get in touch with her family to make sure someone is keeping track of the elderly woman's recuperation. The episode shows how important empathy and compassion can be in trying circumstances, and she was recognized for her bravery in spite of the fact that there was no senior personnel at the accident scene.
So by contrasting these principles, the ethical imperative becomes clear. Prioritize patient safety by avoiding hazardous interventions, protect the patient's well-being through basic care and calling for aid, be honest about capabilities, and seek direction to learn from the circumstance. This technique strikes a compromise between direct patient care and the student's responsibilities and limits. That would be all. Thank you.